Here with us right now to talk about all things COVID-19. Once again, Dr. Rahul Gupta from Hartford Healthcare. Doctor, thank you for joining us again. Before we continue, I want to let you finish your point earlier before the break, so I'm going to give you that opportunity here.
Yeah, so I was saying, the data speaks for itself, and, the acute decline in post-vaccination cases, also the proof lies in the pudding. So I would definitely, want everyone to, educate themselves. And if they still believe that there isn't enough proof, then I guess they have a reason to choose the choice they want to make.
Okay, Doctor, let's talk about what's to come now, specifically this winter. We've heard the Delta variant could be the last major surge of the COVID-19 pandemic, but some have warned that the winter really could prove critical again. Cases nationwide are at their lowest total since August, but some areas are starting to see an uptick again, including those in colder areas as people head indoors. Doctor, in your opinion, how does this winter play out in our area?
So, Rich, I think this winter is is probably going to be like the last one, where we would see a little bit of uptick in COVID cases, not so many flu cases because of our, precautions that we all are taking. There might be a little uptick in COVID cases again, essentially because of the vaccine wearing off phenomena. And since everyone is not going to get boosters, only certain populations will be getting boosters. At least that's how it is right now. So maybe there will be a little uptick, but I really hope towards the end of winter and maybe early spring, we will start seeing the beginning of the end of this pandemic.
And that everyone would certainly like to see that, no question, Doctor. Let's talk about what's to come this week now. The FDA is meeting Thursday and Friday to discuss possible booster shots for Moderna and Johnson & Johnson's COVID vaccines. What are FDA advisors looking at in that meeting, and do you suspect that the boosters will eventually be approved, at least for some Americans, similar to Pfizer's booster shot?
You're very right. So the applications have already been in, and actually anyone can go up and look them up on FDA's website. The initial analysis of the data from Moderna and as well as Johnson & Johnson is in. Let's speak about Moderna first. Oh, okay, maybe let's speak about Pfizer's first. The booster has been out for some time now. It is the same dose as the first two initial vaccinations, and it is essentially given in three categories, which is essentially anyone above 65, people between 18 and 65 with high-risk conditions, medical conditions, which make them high risk for COVID-19 complications, or people who are 18 to 65 who have high-risk work environment, occupational exposures, and things like that. Now, Moderna is essentially getting or filing for its booster shot essentially on the same kind of grounds, but it did put in a word for Delta variant in it. So it is asking for a booster because of the Delta variant also. As you already mentioned, Moderna's shot is going to be half dose, so it's not the same as the first two vaccinations that we get in initial inoculations. It's going to be half dose or 50 micrograms versus 100 micrograms. Then lastly, Johnson & Johnson, they also filed for the booster shot, and they have similar grounds. And they've not really given in that particular paper the doses, but I think it is the same dose. And they have also added all the side effect profile that went in with some of the Johnson & Johnson shots, and they have clearly stated that there was no causal relationship that was found on those data, and they will continue to monitor it closely.
All right. And Dr. lastly, you specialize in internal medicine and geriatrics. Let me ask you, what are you hearing from your patients? Are they eager to get the booster shot, or are they saying, listen, I've done what I need to do. From here on out, I'm finished?
So most of my patients who are elderly and young adults, the ones who got their shots earlier on, they are very eager to get their booster shots. They're rolling their arms up, and I see more and more vaccinated people actually in the office. There is hardly anyone I see who is not vaccinated. And those who are coming in, if their shot is more than 6 months old or 8 months old in case of Pfizer, they are getting ready to get boosters. And some of my patients actually have already had boosters since mid-September, the ones who qualified for them.
And doctor, a quick follow-up on that. Does it matter which vaccine they've received? For instance, Johnson & Johnson. Many people said one and done. Now that may not be the case. Are you finding those patients are eager to get the booster shot when it is approved?
Yes, very much so. As it's been released that, in the United States, at least, we are not doing mixing and matching of the vaccines. The booster is going to be the booster for the original shot that you got. So if you got Pfizer, you get a booster of Pfizer. If you got Moderna, you get a booster of Moderna. If you got Johnson & Johnson, you get a booster of Johnson & Johnson. But they are also, logically understand the limitation of vaccination and the life cycle, time of the antibodies that these vaccines produced. So they are up for a booster after 6 to 8 months.
All right, Dr. Gupta, we're going to have to leave it there. Thank you, as always, for joining us here on The New Normal.